Hello everyone, welcome to today's webinar, Implementing Body Safety and Abuse Prevention Curriculum in Our Schools. I'll introduce our speaker here in just a moment. My name is Chad Sievers and I'll be your webinar host / moderator for this afternoon. And I'm also the program manager for Arkansas Building Effective Services for Trauma. And we've been around and operating since about 2010, training mostly mental health professionals and evidence-based treatments around the state. And we also offer free webinar training such as this. So I'm going to do a couple of housekeeping items, and then I'll introduce our speaker. We really encourage you to ask questions during the presentation. And if you'd like to, please use the question feature, which is on the right side of your screen, and we will answer those as time allows. If you'd like to earn a CEU, just be sure to stay till the very end. We'll have a code that's given, and you'll need to give me that code in order to get that CEU. If you happen to be watching with the group, just let me know the person who was the one who signed in. It's just easier for me to find that in the attendance log and verified who you watched with. We are going to be recording this webinar, and we'll upload this presentation at a later date to our website. And as I mentioned earlier, we've been around since 2010, but we've recently are on Facebook, and we frequently post training opportunities such as our webinars, and our various evidence-based trainings that we do throughout the state of Arkansas. So be sure to check us out on Facebook, like us, and figure out what we're doing. So I'm going to introduce our speaker. In 2005, Casey Atwood completed an internship with the Children's Safety Center in Springdale, Arkansas. Today, Mrs. Atwood serves as the center's program director. One of the hats she wears is leading the training and outreach efforts in Washington County, where the center resides. For the past 2.5 years, she has been training school staff and educating children in the prevention of sexual abuse. Ms. Atwood is originally from Fayetteville, Arkansas. She graduated from the U of A with a degree in social work, where she also currently teaches Bachelor of Social Work students in field placement. So without further ado, I'm going to turn it over to Casey and let her introduce herself and her topic further.
Great. Hello, guys. Thank you all for being here today. So yeah, I'm Casey Atwood, and I've been here at the Children's Safety Center for about 12 years. And in the past few years, I've been able to take on the new role of doing some prevention. So I don't see clients directly as an advocate anymore, and so I'm able to be out in the community providing a lot of prevention and outreach. And so Chad approached me about doing a webinar just kind of about the curriculum that we're trying to implement in the school districts in Washington County, and so that's something that's really exciting that we've been working on, and so I thought that I would kind of talk to you guys a little bit about that. So definitely ask questions. I am in no way the expert on this curriculum or just kind of this movement, but I would definitely feel like I want you guys to ask questions because I might be able to answer them, and there's probably a lot of information to cover. And I know other areas that are doing these kind of curriculums and implementing them into other areas. And so I kind of want to talk a little bit about Erin's Law and kind of what got us started in being able to kind of go into the schools, and then kind of go over a little bit about what's out there, what are some other curriculums that other places are using, maybe across the country, and then just like what we're using here in Arkansas. So we're a lot of places in Arkansas are using the Empower Me curriculum, and so I'm going to tell you guys a little bit about that and what some of the core messages are that this curriculum teaches, and then what all it entails. So it's kind of a threefold training that includes training the counselors, who in turn train the students, a parent night, and then also a mandated reporter training. So I'm going to talk to you guys about that. Okay, so Erin's Law. So I don't know if a lot of you know much about Erin's Law, but Erin Marin is a woman that lives in Illinois, and she was sexually abused as a child, and really has started, like, I mean, she's an activist. She's amazing in kind of the child sexual abuse prevention movement. And so she went to her state of Illinois and got a law passed called Erin's Law. And so what that law does is it requires that all public schools, and they passed it, Erin's Law, in the state of Illinois. And so in Illinois, it requires all of the public schools in Illinois to provide mandated child sexual abuse prevention education. And so that means students K through 12th grade will receive child sexual abuse prevention education. And also it allows for school personnel to have mandated reporter trainings, as well as parents and guardians to be given information about sexual abuse as well. So so Erin is out in our country, going from state to state, trying to get similar laws passed to Erin's Law. So she did come to Arkansas, and in 2014 Arkansas passed legislation not mandating that child sexual abuse prevention be in our schools, but what they did was Erin went to our legislators and they said, you know, she explained everything, and they said, you know, this sounds great. However, you know, what we're going to do right now is we're going to form a task force, so a prevention task force that's going to look into what does Arkansas need, what does that look like, what would that look like in Arkansas if we were to form something like Erin's Law. And so what they decided was they looked at all different types of prevention programs out there, and they really liked the Empower Me curriculum. And the Empower Me curriculum came from the Gunderson National Child Protection Training Center. And so we actually have one, the site in Bentonville that is the Gunderson National Child Protection Training Center regional area, and so that we have that right here in Northwest Arkansas, so that's really wonderful. But they have passed, so the legislator said they really like the Empower Me curriculum. It's cost effective, it's a really good curriculum that meets all of the needs of the families and the children. So you know, yes, we think this curriculum would be great. However, the legislators, you know, haven't mandated that schools implement these curriculums, basically because, you know, then there would have to be you know, funding to be able to provide this to all of the schools, right? So excuse me. So in Arkansas, what's great is that we have advocacy centers, and so us as the Children's Safety Center, we're able to go out and get some grant funding and some funders that agree that this prevention curriculum is really important and that it should be implemented in the schools. So we were able to purchase the curriculum and then go to the schools and kind of explain to them what Erin's Law is, what this legislative task force looks like, that the task force is the task force agrees that this is a great curriculum to be using and that we can provide that for free to their school. So, so I have been going into the schools and kind of selling, basically pitching this idea and this curriculum to them. And it's been working great so far. Does anybody have any questions about Erin's Law or what that looks like? No, so far? Okay. I apologize that I'm coughing. I have some allergy issues and I get a tickle in my throat. Okay, so why is this important? So a lot of schools still in our communities are teaching about stranger danger, and that's great. And, you know, I think that it's important for kids to know about stranger danger. However, you know, we really need to be moving beyond that. So it's going to be, you know, something, you know, over 90% of kids are abused by someone that they know and trust. So it's really kind of beyond stranger. We also, you know that kids are learning in schools about fire drills and tornado drills and bicycle safety and all of these kind of things. And so really body safety is just as important, if not more, than learning about, you know, tornadoes and fire drills and things like that. The statistic is that 1 in 10 children will be sexually abused by their 18th birthday. So, you know, that's really some staggering statistics. And I think that this is just information that really needs to be available to all children. And then whenever I do this training with teachers and counselors, I talk to them about how they might be the only person that the child feels comfortable telling if they don't feel like they can tell someone in their own home. So these are just some primary, principles of prevention. So we just want to look at something that's going to be comprehensive. We want to look at something that's going to have, different teaching methods. The Empower Me curriculum is evidence-based, and so we ask that schools and counselors that teach this curriculum don't really go off topic. So you don't want to, you really kind of want to stick with the script as much as possible. But, you can add different things in as needed. You want to make sure that you're giving the kids the right amount of this curriculum. So, we feel like this is something that they start with kindergarten, and then they're going to hear the same message over the different grade levels from K through 6th grade. You want to look for a curriculum that's evidence-based, which is, always going to be the best practice. It's really going to build positive relationships with the school personnel, but hopefully also with the caregivers at home. You want it to be appropriately timed. So I have found this year that the Springdale School District is really liking to use the curriculum at the end of the school year. And so I'm just now kind of starting to get some of those numbers in of how many kids that have been trained this year in the curriculum. You want it to be relevant, obviously different schools are going to have different cultures, and, you have to kind of take some of those kind of things into consideration. You also want to make sure that you have an outcome evaluation. That's something that I'm kind of still struggling with, is kind of making sure that I can get the information of how many kids are being trained, how many hotline reports are coming from the kids that are being trained and things like that. You want to make sure that the staff that are implementing these curriculums are well trained. So that's something that's really important. So, there are different curriculums, and I'll talk about in a minute some of the other ones that are being taught across the country, and they have actually trained facilitators that go into the schools and teach this curriculum to the children, which is great. Here at our center, we have to really think about staff size. We don't have enough staff members to be able to go into the schools and do that. There wouldn't be enough hours in the day for us to do that. So we had to look at a curriculum that's going to be that's going to work well with what we have. We have to work with what we have. So we're able to go into the schools and train the counselor. So we do kind of like a train the trainer. We also want to find a curriculum that encourages parental involvement. So that's really, really important, because, we can do everything we can do with these kids, but, if their parents aren't involved and kind of don't have that information, then, it might not get very far. So these are just some things that are just, for primary abuse prevention in general. You want to think about how you can have training for all adults that work with children and youth. So whether that's training to be able to implement a curriculum like this, or whether that's training on mandated reporting, on signs and symptoms of what to look for, how to talk to kids, things like that. You want to make sure that any youth serving organizations have appropriate background checks, child protection policies, if they have codes of conduct, and, if they are mandated reporters, what's their reporting policy and things like that. And just remembering that protecting children does require an environment where kids do learn about body safety and healthy relationships and appropriate boundaries and how they can talk with safe adults about that. So these are all things that that prevention in general that are really important. So whenever we thought about kind of making a prevention plan, we definitely wanted to look at the community needs and kind of think about, again, kind of thinking, well, we have one staff person, so we want to look at some way that we can kind of train that staff person, being me, kind of, so we can look at how are we going to get the most bang for our buck. So how are we going to get out in the community, being one person that's able to really train as many counselors and as possible to be able to provide this curriculum. We have to look at our target population. So we were able to look back at our statistics and first find out which, we kind of went by zip code. So which areas of the county we're receiving the most reports from. So you could look at that in two ways. We found that Springdale, over 44% of the kids that we saw last year came from Springdale. So we can see that abuse is happening in Springdale. But we also can see that a different zip code that maybe doesn't have as many kids coming from that could be because maybe they don't have the information or the knowledge, and so they're not disclosing. So you want to kind of look at which target populations you might want to look at first and kind of reach out to those. So in Washington County, we kind of have Fayetteville and Springdale as our two large school districts, and then on the outskirts you have several more rural areas and smaller school districts. And so Then I was able to create, kind of look at like what a logic model would look like, and kind of a timeline of like when I want to do this. This has not been able to work out in every aspect, but I think that it can be really helpful in figuring out kind of where you want to start and where you want to go. And then you want to look at what the evaluation plan is. So luckily, I was able to really kind of piggyback off of Benton County. And so I had went, originally, whenever I started looking into doing this, I went and shadowed Rita Farrell with Benton County, and I'd watched her train a group of counselors in Benton County so that I could kind of figure out like where I wanted to go and piggyback off of that. So that was super helpful. And luckily Gunderson National Child Protection Training Center, who came up with the curriculum, already kind of has an evaluation plan and an evaluation piece to the curriculum. So that's really helpful too. So here's my logic model. So it just kind of thinking about like, what do we, the goal obviously is child sexual abuse prevention, and the project is kind of implementing a curriculum like this into the schools here in Washington County. So, what we're able to invest into that is, myself to be able to train the counselors, conduct mandated reporter trainings, do a parent night, and then the Children's Safety Center is able to provide a free curriculum to each school district. And so, what we do is train the counselors on the Empower Me curriculum, provide the mandated reporter training, and then the parent night is optional. So we haven't had as much luck with the parents being as super involved to have a parent night, or maybe that's because the school staff hasn't had that be an option. But the parent nights we have had have been very wonderful and had really good response from the parents that have came. Who we reach. So far I have successfully trained 27 school counselors, 35 school staff, and 60 parents. So next week, actually, I'm going to be training about 18 more counselors, because I'm going to be doing all of the Fayetteville Public Schools elementary school counselors. And so I'm really excited about that. So why this project? There are going to be some short-term results, long-term results, so obviously it's going to be great because kids are going to be trained in body safety education. I think it will help the school teachers and staff feel more prepared, when kids do come and disclose to them, and then parents are going to feel more empowered to be able to talk to their kids about this. So this is like a really tough subject. And a lot of times parents, I hear parents tell me all the time that it's something that even they feel uncomfortable talking about. So however we can make them feel empowered is really important. What's great is that these kids are going to hear the same message over grade levels. And so I think that that's going to be really important, because it kind of will get ingrained into their mind. So it's really will be interesting to hear from some of these kids that, when I hear evaluations, that if they've started this year in kindergarten, and kind of how we're able to assess how they've taken in that information whenever they're, say, in 3rd or 4th grade. So again, it's going to help children just feel more safe to disclose. And then long-term, kids are going to feel more knowledgeable about body safety. We're going to have improved policies and procedures in schools for child sexual abuse prevention. So again, some assumptions that we have are going to be that obviously that funding would be available for each, for the curriculum to be in each school district, and that schools will schedule parent nights and mandated reporter trainings, and just that we have buy-in from each district. So what I've been doing is actually, for the smaller school districts, I've been contacting the school counselor directly, or even the school principal. But for the bigger school districts, I've gone through the superintendent and had set up meetings and been able to kind of just let them know what this is about, and that it's free, and that we are able to provide this to their school for free, and we've had really good response from that. So we also have to think about since luckily we do have a grant that will provide, but it's not mandatory, so some districts could choose not to participate. So far we've not had that happen, but it is something to think about as well. Okay, so I'm just going to briefly touch on what else is out there. So there is a program called Speak Up, Be Safe, and that is through Child Help USA. And this is a curriculum that is very similar to Empower Me. So it has 5 safety rules. It has a lot of resources for teachers, for parents. It actually, one really cool thing about it is that it has a interactive web support. So you can kind of go online and look at a lot of different things that they have through a website. But it again builds on their skill set every year and is developmentally appropriate. So one thing about this particular curriculum is that all of the people that implement it are trained and certified facilitators. So it would be something where someone would have to come into the school and implement it with the children directly. What we have found that can be a problem with that is that if the school counselors implement the curriculum directly with the students, they do not have to get parental consent and send a letter home and all of those kind of things. Now, if they were to bring in an outside person to directly implement the curriculum with the students, then they would have to make sure that the parents were okay with it. They would have to sign, something saying that that was okay. And that can be a real barrier because a lot of parents think, I don't want some outside person talking to my child about sexual abuse. So that can be kind of a barrier there. Even though the Empower Me curriculum is not something, scary or talks about penises and vaginas, but it is still a concern for a lot of parents in our community. So that's what Speak Up, Be Safe. And then there is Child Safety Matters. That one is also really awesome. I mean, it's a really great program too. They're using it at a lot of different places across the country. And it also utilizes trained facilitators. One thing about this program, though, is that to buy the curriculum for one school is $2,300 just for K through 5, and then if you wanted the 6th through 8th grade program, it's $1,700. And then for an additional site, so a different school, you would pay $300 extra to add it on to an additional site. What's great about Empower Me that we're using is that we're able to use one curriculum for every school district. So like, for example, with Springdale School District, we were able to provide them one curriculum, and then they can disperse that throughout to each elementary school. So there are 18 elementary schools. They're able to share the curriculum with each school. So that's really helpful. But the Child Safety Matters is, again, very similar. It's got a lot of interactive and engaging games and things like that for kids, which is really awesome. So it does have a lot of really cool extra added features. It even has an app for parents, but as far as being cost effective for something that, if we're kind of out there looking for funds to be able to provide this to each school district, it's not going to be something that we are probably going to be able to utilize at this time. And then there's the second step, which is through a child protection unit. Now this one is, again, similar to the one that we're using, but it also kind of has some extra little added bonus and interactive activities and things like that. This one is $3,500 for the K through 5th grade bundle. Then there is another one called Healthy Relationships Project, and this one originally came out of Canada, but now it's in Vermont, and so it's through Prevent Child Abuse Vermont, and it actually has 3 separate, so it has 6 units for like pre-K through 2nd grade, and then it has a different one called We Care Elementary for 3rd through 6th grade, and then it has a sexual abuse-free environment for teens, which they call Safety, and that's for 7th and 8th grade. So that one's great too. So there are lots of different options out there, but in Arkansas we've just really picked up, and what the Legislative Task Force has recommended is the Empower Me curriculum. So the last one, the Think First and Stay Safe, is through the Child Lures Prevention, and that one is probably the most cost effective besides the Empower Me one, but it costs $489 for the regular curriculum. But it also covers all forms of abuse and bullying, which the Empower Me doesn't really necessarily cover bullying. I mean, it talks about telling someone if anybody makes you feel uncomfortable, but it doesn't necessarily have a focus on bullying. So I think that's really great too, that some of these have touch on bullying. So the Empower Me. So what the Empower Me is it is an evidence-based curriculum. So again, the child hears the same message through grade levels. It is interactive. So if you were to purchase it, I think it only costs $250 for the whole kit. And again, you can share that with an entire school district. So even if there are more than one elementary school, you're going to be able to share that information. And this is strictly for K through 6th grade. And so it comes with a kit, like I said. And so what we have found, okay, so first of all, in the kit, you have, it has a DVD that shows a woman with Gunderson Child Protection Training Center actually doing the curriculum with a group of children. So that's been really helpful for the counselors that I've trained, and them being able to kind of go back and watch someone actually do it for the first time before they implement it themselves. It also comes with presenter notes. It comes with like frequently asked questions. It comes with a PowerPoint. It actually comes with a letter, kind of a form letter if they decided they wanted to send letters home to the parents. So it has a lot of really good stuff in there. So it has like a flash drive and a disk and all of that kind of stuff. So that's really good. What we have found is that whenever you have a bigger school district, they're able to put all of the information from the like the disk to the PowerPoint to, you know, the form letter and all of that kind of on a shared drive that the counselors can access. So if you have a bigger school district with several schools, they can put that all on kind of a shared drive and be able to share that information. So that's just a tip that we have found to be helpful. So it is threefold. So I think I've mentioned this already, but it's going to meet the needs of the children. So it is the body safety education. Then we're also, you know, so I train the counselors, but then I go in myself and do mandated reporter trainings with the school staff. So that would be counselors, that would be teachers, you know, because you think about if we're implementing this curriculum, then we're going to have students that are going to be then disclosing to counselors, teachers, things like that. So we really want to make sure that they're well prepared for how they're going to respond if a child chooses to disclose. Then we also have an optional parent night. So I hate that it's optional. I really think that all of the schools should be doing this, but this is something that I'm hoping in the upcoming year that I'll be able to really kind of implement more and maybe bring back more information on how that's working out. Okay, so these are the core messages of the curriculum. So again, we don't teach stranger danger. So it definitely has touches on strangers. It doesn't really say the word stranger ever, which I think is good, because really we want kids to know that it's about the behavior of the person and not their relationship with them. So knowing that over 90% of kids are abused by someone they know and trust, we don't want kids to be scared that it's going to be someone they know and trust, but we want to just teach them to focus on if a behavior of a person is what it's about and not the relationship with them. So we don't really ever say good touch, bad touch. I think a lot of everyone's kind of in the prevention movement is kind of getting away from that because, you know, a touch that could be bad could feel good on a child's body. I mean, there can be a lot of confusion with good touch, bad touch. So we really veer away from that. We teach them that most grown-ups want kids to be happy and healthy and safe and strong. I mean, that's normal. I mean, most grown-ups do. So we want that to be known, that it is, again, not a scary curriculum, but it teaches kids that, you know, that most grown-ups want them to be healthy. We also teach telling versus tattling, so I think this is really super important. So a lot of kids, whenever a child discloses, will disclose to a peer before they disclose to an adult. So, you know, but then whenever you're in elementary school, if you think about it, a lot of kids are being told not to tattle, right? So it's like, you know, don't tattle on them, you know, quit tattling, things like that. So we want to teach kids that telling is to get someone out of trouble, where tattling is to get someone into trouble. So it really kind of goes into and explains that a little bit further as well. But we also say that we always want to get a grown-up involved when someone's being hurt. So part of the curriculum is to teach kids that they should have 5 trusted adults that they can tell if someone is hurting them, or if they're being hurt, or if a friend is being hurt, or anything like that. But, you know, a lot of times kids might say, oh, well, one of my people would be my older sister, my older brother. Well, we want to make sure that we have 5 trusted adults and not like an older juvenile. And also just, you know, in more and more of our cases, juveniles are offenders. So, you know, we see a lot of cases where the offender is an older juvenile. So again, it's about the behavior of the person and not your relationship to them. So if anyone is hurting them, not just, you know, if an adult or a grown-up is hurting you, come tell me, but, you know, if anyone is. So this is kind of, we have lesson plans, and so I give out lesson plans that has an entire script whenever I'm able to go and train the counselors. So it's really helpful for them to just have a lesson plan. What I found is that the schools that we've been seeing, you know, I've kind of asked, are you guys using a curriculum now? Is this something that you've been doing in the past? And a lot of them have been doing more of a stranger danger type lesson, something maybe that they got online or that they just printed off something off of the internet for free. And some of them have just kind of created their own kind of safety something, you know, so really I've found that no one has had an actual curriculum that they've been utilizing throughout. So it's been really interesting and kind of eye-opening to see that. So anyway, so the first part of the curriculum goes over, so it almost kind of goes in reverse. So the first part is what to do if someone breaks one of your safety rules. So the curriculum starts out with talking to the kids about, you know, how many of you have had bus safety? What about bicycle safety? And what about, you know, like thinking about all of the kind of things that they might be learning about safety. And then they say, what about body safety? So today we're going to talk about body safety. They make it interactive by saying, you know, okay, I want everybody to stand up, and or if they don't stand up, they can sit down. Everybody put your, when I say, you know, point to one of your body parts, everybody point to it. So everybody put your hands on your head. What about your shoulders? What about your knees? You know, things like that. And then they say, now everybody grab your gut. And so it's like, well, okay, well, what is that? You know, so then it's a really good time for the trainer to kind of talk to them about that gut instinct and what that looks like, and you know, how they might not know exactly where their gut is, but that's kind of a feeling inside, and so they're able to kind of talk about that and how that feels, and that, you know, it's kind of, they can call it an uh-oh feeling or a gut feeling, and it kind of helps us to know if we're safe. And so then they can give some what if examples. A lot of the curriculum involves giving like what if examples. So, you know, what if a deer is sipping water at a stream, and, you know, kind of gives that visual, and they're imagining it, and it hears a rustle in the bushes. And so what does it do? It's going to run away. Well, it probably got that gut feeling, you know, that uh-oh feeling, because it felt like something wasn't right. So it kind of got scared or felt like something was uncomfortable. Another example they give is, what if you were in a store with your friend and your friend stole a candy bar, and you guys left the store, and you would kind of get that feeling in your gut because you knew that wasn't really the right thing to do, you know? So like you can come up with lots of different what if questions to kind of say how that gut instinct would go off. And so then you want to talk to them about, what if somebody's like, if you're trying to think about something and you're trying to figure something out, or think about if your gut feeling's going off, what if somebody's like right in your space, you know, like what would you do? It's really hard to kind of think about what you want to do if somebody's up in your bubble, right? And so if that ever happens, then you can always take 2 steps back. So if someone's ever trying to break a safety rule, or you need to stop and think for a second, you can always take 2 steps back. And so then they can, you know, make this interactive, and like they can scoot back, they can step back, they can make some hand motion back, you know, so that's kind of the 2 steps back. Then they can always say no in a loud voice. So sometimes they'll say, you know, depending on the age group of the kids, it'll be like, okay, everybody yell no, you know, with a loud voice. And then they can run away, which all of these go through like different scenarios and what ifs and things like that. But for time, I won't make you guys go through all of that. But so the running away, sometimes when they're younger kids, they'll slap their knees, you know, like they're running away, and then they're going to find a trusted adult. So they teach them that they should always have 5 trusted adults that they can talk to. And so they kind of will be able to go through that with younger kids. You can have a worksheet that you could look at, that you could create. So with really young kids, they could even draw faces of the 5 people, you know, that are their trusted adults. And so it kind of goes through this whole hand motion, which obviously you guys can't see on a webinar, but they go through these steps, and they're able to kind of really practice these steps of what they would do if somebody tried to break one of their safety rules. Okay, so, and then it goes through the safety rules. So these lessons can be broken down into as many as 5 different separate lessons. So sometimes with kindergartners, they've said, you know, they can do about 10 or 15 minutes max, and then they're going to be like done, right? So you could break it up into as many as 5 different lessons, down to just 1 lesson. So with like a 4th or 5th grader, you could do the whole thing in 1 30 to 45-minute lesson, you know, so it really is able to kind of be flexible and be spread out depending on how that counselor feels about their students and what's more appropriate for them. Okay, so the safety rules. So the first one is check first. So then they just go through a lot of different scenarios as far as like, you know, we always just want to check first. If we ever have anybody like ask us to go somewhere with them, or if someone's trying to, even take a picture of us. I mean, there's so many different examples, but just that we always want to check with the person taking care of us. And we say the person taking care of us because we don't know that some kids might live with their grandparents, they might be in foster care, so we just always kind of focus on, we always want to check first with the person taking care of us. And then we say lots of different examples. So one example would be, you and your friend are going to walk to the park, and so you're on your way to the park, and then your friend says, "Hey, let's go to this other park over here instead." What do? Well, you probably want to go check first with the person taking care of you because they thought you were going to this other park. So there are lots of different examples like that. It gives the what if examples to the teacher, so there are lots of different examples so that the teacher can, or the counselor, can have those whenever they're implementing the curriculum. But then also, as long as they pretty much stay on the script, they could come up with some other what if questions for this as well. So then they want to talk about no secrets, and so this could even be like a separate lesson. So if you do break it up into different lessons, you want to kind of always at the beginning remind them what you talked about before. So, if you were doing secrets today, then you would want to kind of go back and say, okay, before we talked about how you would want to check first, and then, but also what do we do if someone breaks a safety rule? And then you would go over, take 2 steps back and yell for no and run away and find one of your 5. So when they talk about secrets, they talk about how the difference between secrets and surprises, how, secrets are something that sometimes can make people not feel so great, and surprises are something that are fun. They can talk about how surprises are something typically that we might keep for a short amount of time, and secrets might be for a long amount of time. They go into lots of different examples about that. They actually, with younger kids, you can play a game where you would say, okay, I'm going to say some different examples, and if it's a secret, then you're going to put your hand over your mouth, and if it's a surprise, you're going to put your hands up above your head. So, you might say, if someone came and told you that they were going to have a surprise birthday party for your friend, but not to tell anyone, would that be a secret or surprise? And then, they could put their hands up if it's a surprise. So they talk about lots of different things. And then, they always want to add in a few things into each lesson about, but if someone told you a secret and you didn't tell, and it was something that made you uncomfortable or something, then you can always come and still tell, and it's not gonna be your fault, or things like that, because we do know that some kids have already been abused, and maybe they felt like it was, they were told to keep a secret and they didn't know what to do. And so we always want to kind of go back to that, like, it's still never going to be your fault. You're still not going to, be in trouble with me or anything like that. So those are just some other examples. And so then the third safety rule is we talk about touches. And so that's whenever they kind of talk about your body being special, and that some of your body parts are private, and that our bodies let us do wonderful things, and it helps us to draw or climb trees, or, and how we just really need to work to make sure that we keep our body healthy, because that's our body that we get to do wonderful things with. So then it talks about the parts of your body that are covered by your bathing suit or your private parts, and if anybody ever wants to touch them or look at them, or wants us to touch their private parts or look at their private parts, that would be that would be a time whenever we would want to go find one of our 5 trusted adults. And then we also want to say, if someone ever tricked us into touching them, or if they ever, forced us into touching them, that we can still always go and tell, and that's again, kind of reiterating if something had already happened, or if they didn't feel like, we want to reiterate if they didn't feel like they could yell no, or, obviously a lot of kids don't disclose and don't scream for help, which is totally normal. So we want to reiterate that if they aren't able to do that, that's okay too, and they can still go and tell one of their 5 trusted adults. So, it talks about how it's never a child's fault if they get tricked into a touch, if they if they are forced into a touch that's scary or confusing, that they can always go and tell one of their 5. So then, we want to give those concrete examples and talk about times whenever somebody might touch somebody's private part, right? So we could talk about, if you go to the doctor, then a doctor might have to look at your private parts, and that would be a touch that would be okay, but that touch would not ever have to be a secret, okay? So if you see your mom or dad change your brother or sister's diaper, then that might be a time whenever they have to touch them to clean them and make sure that they're healthy and clean. So that would be a touch that would be okay, but again, that touch wouldn't ever have to be a secret. So you really want to be able to give these concrete examples to what is a healthy touch and what could be a touch that would not be okay. So then you would give some different what ifs. So what if your friend's babysitter asked to look at your private parts? So then somebody, you would hopefully get an example, and a child might say, I would want to think, if you want to think about it, I would take 2 steps back, I would yell no, I'd run away, and I would tell one of my 5, so you can go through kind of what that looks like. But again, if you weren't able to do that, then you could still always go and tell one of your 5 trusted adults. So then the last one is just that we tell if someone's being hurt. So that's really where it focuses a lot on on telling versus tattling, just how important that is to tell someone. But what's really great about this curriculum is it really talks about, it's just really powerful how so they talk about how people are like snowflakes and how we're all so unique and that there's no one out there like us, and we all have different dreams and goals, and everybody wants to be able to achieve their dreams. But if someone's hurting someone, it's really hard for them to be able to achieve their dreams, and it's hard for them to be able to do all of the amazing things that they're capable of doing, right? So they use the example of, if someone hit your thumb with a hammer, that would hurt really bad, right? So it'd be really hard for you to sit here and think about your dreams and all the awesome things you want to do if your thumb hurts really bad because it got hit by a hammer. You really would only be able to kind of focus on that. So again, if a child discloses to a peer, then we would want that peer to feel like, I can definitely go and help them because I want them to get them out of trouble. So again, that goes through lots of different what if questions, and then you really want to, kind of go back over everything and kind of recap. But it's a really simple curriculum that, I didn't go through every single step of it, but I mean, like, that's pretty much it. So it's pretty simple and to the point. It's cost effective. It's I've had some really, really good luck with it so far, from what the feedback that I've received. In fact, I feel like I have a really good success story. I have, I mean, of course, we always are redefining our definition of success, but a few weeks ago, we had a family that came in, and it was a girl that was probably 4th or 5th grade. And she had disclosed to her counselor, and in fact, she had disclosed to a peer, and they had both disclosed to each other that they had been being abused. And she disclosed to her counselor, and her counselor ended up having to bring her to the center with the school resource officer because the offender was her stepdad in the home. And she had told her sisters on the way here not to disclose what had been happening at home. And she ended up disclosing in her forensic interview about ongoing sexual abuse for several years by her stepfather. And then was able to come out of her interview and tell her sisters that it was okay for them to tell. But while they were here, I went out and spoke with the school counselor, and she let me know that they had just done the Empower Me curriculum, and that's why this disclosure came out. And so it just felt so good to hear that that this is working, and it's kids are starting to feel safer to tell whenever they have this information. So that offender was arrested, and the children are safe. And so I feel like again, we have to redefine our definition of success sometimes, but for me that is a real success. So the evaluation piece is Gunderson has an actual evaluation form, and so what I ask whenever I do the training with the counselors is just that they are able to provide me with how many children have been given the education, and then how many disclosures come directly from the curriculum, right? So that would be obviously outcries that come immediately after the curriculum's been presented, but these school counselors probably have to make several hotline calls throughout the school year. And so, but even if this was a case where maybe 6 months later after they had been given the education, they came back and said, remember whenever we talked about, places that nobody should touch or something like that, and then they disclosed, then that would be, I think, directly related to them having the education, but if there was just an outcry that maybe we didn't feel like was related to this, then that wouldn't necessarily count. But we're trying to kind of figure out how many disclosures and hotline reports have been made because of the education. So far, it's been really hard because I know these counselors are busy and I haven't really been hounding them too much, but so I just recently reached out to the Springdale School District, which again has 18 elementary schools. And they've all been provided, I've trained all of their counselors, and so I reached out and said, before the end of the school year, I'd really like to have the evaluation as far as how at least how many students have been given the curriculum and how many hotline reports. So I've only received information back from 4 schools so far, and over 2,000 students have been given the information. So that is really amazing. And so they're still working on figuring out exactly how many hotline reports have been made. But even just one teacher and one counselor so far, just one of them, her email back to me said, to my knowledge, 1 hotline report, 1 disclosure consisting of 4 victims and 2 perpetrators and 3 arrests have occurred as a result of the Empower Me lessons. Thank you for what you do. So that's really, even if we get 1 disclosure, that's 1 child that's going to be safe. So I feel like every school that sent me so far has said that there have been at least 1 to 4 hotline reports from giving the education, and so I'm waiting to hear back from other schools. But I mean, that's just 4 schools. That's over 2,000 students. So that's just really, really exciting to see kind of what's happening. And so far, some of the feedback that I've received is just that they really feel like the 5 trusted adults portion has been really, really beneficial for the students. And also, which is, you would think sounds kind of crazy, but just the kids, teaching the kids what parts of their body are private, that, a lot of families are still not kind of teaching their kids this kind of stuff. So, it's really important information for them to have, because, we see kids that a lot of times maybe didn't even know that, what to call what was happening to them, because maybe they had never been talked to about this kind of thing. So, really important stuff. So this is something that I share with the counselors whenever I just do the initial training, but then also is included in the mandated reporter training. But I just think is so important for everyone to know if a child discloses to them just some of the things that you want to do or not do. So just listening carefully, paying attention to your body language, telling the child how brave they are for telling you something like this, documenting, calling the hotline, all of these things are really important. And then things that you don't want to do would be obviously to try to conduct the investigation yourself, ask leading questions. So just remember open-ended questions, saying, tell me all about that, not acting shocked or horrified or scared, which I know can, seems obvious, but that can be kind of hard to keep a poker face whenever a child, shares some of that information that can be pretty shocking. Don't try to talk them out of what they're saying. I always use an example whenever I train people and say, what if a child disclosed to you that one of your colleagues or your coworkers or, had done something to them? It would be really easy to say, well, was it an accident? Because you've known this person for years and surely they would never do that, so you never want to try to talk a child out of what they're saying. And then, let the investigators contact the parents. That's really important. And don't ever make the child feel like it was their fault. So that's pretty much my spiel. I want to let you guys have any questions. If you guys have any questions at all or want any more information about this, I'll be happy to share it with you. Yeah.
All right, thanks, Casey. Really appreciate that presentation. So just as a reminder to type in those questions as you are thinking about them. And we did have one question that came in, and this person wanted to know, could individuals purchase the Empower Me curriculum? For example, therapists in private practice. Is that an option, or do you know?
Yes. So it is on the Gunderson National Child Protection Training Center. if you Google that, it has a store and you can purchase the curriculum there yourself. Yeah, so I mean, I think that it's a great curriculum even for, like a church to have, yeah, like any sort of mental health professional. I mean, yeah, so the more people that can get that out there, the better. I think it's some really great information for sure.
Okay, and another question, I think you touched on this briefly in the beginning, Casey, but does the legislation or Erin's law, does that apply to private schools?
Well, so Erin's law in Illinois, so there can only be one Erin's law, and that is in Illinois. So if they did pass it in Arkansas, it would be called something else eventually. But no, but in Arkansas, so in Illinois, it's public schools only. In Arkansas, it is, it is recommended that schools have the education, but again, it's not mandatory. Now we have. So it really doesn't even specify public or private because it's not mandated anywhere. However, we actually have the funding to be able to provide it to private schools as well. So that's kind of next on my list, is to reach out to some of the private schools in the area.
Okay. We've got a couple of folks who are interested in becoming Train the Trainers in Empower Me. How does that process work, or can you talk a little bit more about that, of maybe how you became a trainer?
So basically, I didn't go through any like specialized training or anything. I just Benton County had started it before me, and so Rita Farrell, who she actually worked for Gunderson National Child Protection Training Center and worked for the Benton County Advocacy Center, so she kind of trained me on it, and then I was able to take off. So if anybody wants to email me directly, I would be happy to like sit down and kind of train whoever wants to learn more about it. That would be happy to do that.
Okay, we're getting a couple more questions in here, so I'm just kind of reading them right now. So the Empower Me that you're working with now, Casey, is the K through 6. Is there anything for high schools or middle schools?
Yes, so last I had heard, Gunderson was trying to, they were creating a 7 through 12 curriculum that was going to be probably geared a little more, healthy relationships and things like that. So I do know that I believe Benton County, Melanie Hallbrook is possibly already providing that training, maybe in Benton County. So she would be a good contact to reach out to. And so her name is Melanie Hallbrook, and she does the kind of the education coordinator at the Benton County Advocacy Center.
Okay. And this next question is just kind of a clarification, is that this curriculum is free to Arkansas schools, including training. I think what you mentioned earlier, Casey, is you're able to provide this training free to Washington County schools because of the grant that your safety center received. Is that correct?
Yes, so the curriculum itself is like $250. So if you were to go on Gunderson's website, you could purchase the curriculum for $250. We here in Washington County have received grant funding to be able to provide the curriculum to each school district in Washington County. I believe Benton County also had funding to be able to provide it to schools in Benton County. And I know that Cody Tatum with Grandma's House, which is in Harrison, has been providing this curriculum to the Harrison School District, but I don't know as far as the funding to provide it outside of that area. So I don't really know what other areas are utilizing this.
Okay. And I'll do one more question, then we'll kind of move on to the CU slide and take some more questions. Someone asked about with the K through 6 training curriculum, how do you talk with counselors about maybe what might be normal sexual development with kids who just might be curious? So I'm just kind of trying to paraphrase this question here. Is just does the Empower Me kind of touch on how to talk to counselors or educators about what is normal sexual development in K through 6
So that
grade?
part would be in the initial training, and then also with in the mandated reporter training. So I have a whole different PowerPoint that I do for that training, and it does go through kind of like normal development, like what are red flags and what are normal sexual behaviors for kids, and it breaks down from like preschoolers to, early elementary on up, all the way up to teenagers. So yeah, we're able to talk about that. And then if they have certain questions, a lot of times they'll come with questions saying, oh, I had a case where this happened. Like, what do you think about this? So it just kind of depends on what their questions are. But yeah, we definitely cover that.
Okay. So I've got the CEU slide up, and the code is displayed on the screen. Send me an email, and if you let me know your first and last name, that's really helpful, and I'll try to get those out to you later today or tomorrow. And if you're watching with a group, just remember to let me know who the person was that signed in. And if you happen to be watching this at a later time, we only award CEUs for attending live webinar presentations. So I'll have this up for a bit, and we'll take a couple more questions here. Let's see, I'm just kind of reading through some of them. So kind of back to the funding issue, Casey, do you know what grant you used or what your funding source was?
Yeah, so actually ARBEST is who funded us, and that was really, really we just kind of lucked out because our board president works for ARBEST, and so he was able to kind of reach out to some people within his agency to be able to kind of talk about the need for this curriculum. So that worked out really well for us. I feel like I can't remember if Benton County told me it was like they got funding from like the Lions Club or kind of something like that, like one of those type of clubs that they were able to receive funding from. But, we even talked about, with the curriculum only being $250, you could almost get like an individual sponsor or something, like for a certain school. So like say you knew somebody that lived in, like a certain little town, and you could say, could I find somebody that would want to sponsor, this town receiving, this curriculum for a school. And so I think that would be really doable too.
Hey, and just to clarify, ARBEST the bank, not ARBEST the who we are. Yeah, we oftentimes get confused with that, but yeah, I know what you're talking about, Casey. But yeah, I think the community members and getting those small time little one-off grants is a great way to develop partnerships.
Yeah.
And this is just more of a comment. I know we have some other advocacy center folks on this webinar, and some people from West Memphis area who also do the Empower Me and the Darkness to Light curriculum, which is geared for older adults. But so I encourage you to reach out to your local child advocacy center and ask them about Empower Me. That's probably a great way to get to know your local CAC and what's happening in your school system. Okay, well, I'm going to do one last call for questions. And just wanted to, Casey, thank you for the great presentation and letting us know what's going on in Washington County. And of course, if folks have questions after the webinar, you've got my email, and I'm going to back up to Casey's in case you wanted to write that down in her contact information. So I'm not seeing any other new questions come in, so I'm going to end it for today. And thank you, Casey, and thanks for everyone for joining.
Thank you. Thanks, Chad. Thanks, everybody.
All right. Take care.